Okay, I think we'll begin. Welcome to Dementia Awareness, a DARTS presentation. My name's Sandy, and today we'll be taking a look at the topic of dementia and brain health. We'll be reviewing normal aging of the brain and changes in the brain that occur with the disease of dementia. We'll also go over the main types as well as a guide for communicating with someone who has dementia, what is sometimes medically called cognitive impairment or neurocognitive disorder. For those of you that are familiar with typing in a question for Zoom, feel free to do so at any time. My coworker Tabitha will be monitoring any questions, and we'll pause in about 20 minutes, if any, to see if there's any questions so far. For those who are joining by phone, please write your questions down, and we will take time at the end of the presentation, which will be 45 minutes to 50 minutes, I believe, to be able to ask those questions. For now, everyone is, besides me, is on mute to minimize background noise, but we'll get a chance to ask questions or comment later. I want to start by just saying, as we age, we experience physical changes, such as our eyes changing, needing new glasses, or having cataract surgery, our hair turning a lighter color, or feeling stiff when we get up in the morning, or rising from a sitting position after a period of time. And we also experience some changes that are normal for our thinking. We might not remember names as quickly or easily as we once did, or have trouble concentrating when you're in a busy setting. These are all normal parts of the aging process, and we're going to be looking at a number of those. So pause a second. I'm going to share PowerPoint with you so you can see these points. All right, get this set up to start. All right, here we go. So we're going to talk a bit about normal aging. What is the normal aging look like for our cognitive function? Well, we might sometimes forget names or appointments, but we remember them later. We might make an occasional error in balancing a bank account. We might need occasional help to use settings on a microwave or a technology device, particularly if it's a newer one, or it's not using it, or you don't use it that often. We may confuse the day of the week, like thinking, what day is it? But recall after a time. Also, for normal aging, vision changes from, like we talked about, for cataracts or other eye disease, glaucoma, macular degeneration. That's normal aging. We have some more here. Sometimes a person might have trouble finding the right word. Pause and think about it before it comes to mind. Normal aging a person might misplace something but be able to retrace steps in your thoughts to probably where you left it after a bit of time goes by. We might make a bad decision occasionally. We realize that, later. Sometimes we just might feel weary of work or social obligations or noise. And normal aging could include becoming irritable when routine is disrupted. Those are all part of the normal aging process. Now, what is dementia? We'll talk a bit about that. As you can see, it says it's a general term for a decline in mental ability that is severe enough to interfere with daily life. So what is daily life? That could be forgetting medical appointment, no longer able to plan meals or activities, forgetting to eat, getting lost in a familiar area while driving or walking, going outside in winter without a coat. Those are situations that are interfering with daily life and safety. A number of different diseases can cause dementia. Again, what is dementia? It's not one specific disease, it's an overall term that describes a wide range of symptoms associated with decline in cognitive function. It is not a normal part of aging. Not everyone has the disease of the brain known as dementia. Many dementias are progressive, meaning symptoms start slowly and gradually get worse. So let's talk about early diagnosis. It is key. A person's symptoms might have a reversible cause, so it's important to keep in touch with your doctor and your labs and your mood, to have a mood assessment for depression. A person could have a low vitamin B12, or a urinary tract infection can cause changes in cognition that can be reversed with treatment. Appropriate and early treatment might slow the rate of further decline and lessen symptoms. Treatment is typically more effective when started early in the disease process. And the diagnosis tends to be more accurate early in the disease process. It's important to know that having an early diagnosis enables the person to participate more fully in decisions starting now. Having a power of attorney document for finances or a healthcare directive to know what a person's wishes are. These are very important things to talk about and think about, especially if health changes with loss of memory and cognitive ability, to have that looked at early on. More information on early diagnosis. It allows the person to focus on what matters most to them. They wish to travel or spend time with grandchildren, whatever what their goals are for their life. It allows the person to take advantage of services and resources available sooner. It makes a person eligible for a wider variety of clinical research trials, which advance research and may provide medical benefits. Early diagnosis can help reduce the stigma associated with the disease and further people's understanding. It's a chance to have conversation with family and friends rather than everyone burying their head in the sand and not talking about it. helpful to have conversation and share and educate family and friends. There's a lot to be said here for early diagnosis. It helps a person's family by giving them opportunity to learn about the disease, plan for the future. We kind of mentioned that a little bit before. And also, this is significant to attribute changes to the disease of dementia rather than to the person or their personality. This may help lessen anxiety about any symptoms. Early diagnosis allows for participation in early stage support groups to share feelings and coping strategies. There are dementia support groups for folks with dementia. Taken all together, these advantages result in a higher quality of life for the person with dementia, less stress for the family, and more time to treasure the present and prepare for the future. I do want to bring up one thing about early diagnosis. I think we'll look at it at the end if we have time also. Let's go on to talking about symptoms of dementia. Usually there's at least two of these following functions that a person would have to be considered diagnosed with dementia. Memory, which is usually short-term memory loss, not being able to recall that they just asked the same question, or they're not able to recall what they had the previous meal. Communication and language. This is where a person may have trouble understanding what is said, the content of the words, or be able to follow a conversation that's happening. Ability to focus and pay attention. It could be not able to follow a television show or a movie or read to the degree that they used to read. Reasoning and judgment. A change in the judgment perhaps of going outside when the weather's poor and not being dressed properly, or being stuck in their reasoning and not able to listen and understand another person's point of view. Visual perception is another symptom, a change that can be an indicator of dementia. Being able to look at a key and to try to place it in the keyhole. Someone that's having trouble with that, where that wasn't the case previously. Or walking, and whenever a change in floor pattern would come up, a person might pause or step over it, not being able to understand the spatial perception of what they're actually seeing. So if a person has two of the following core mental functions, it's considered that it would be dementia unless other things are ruled out. Here's some effects of what's happening with dementia. It's caused by damage to brain cells. This damage interferes with the cell's ability to communicate with each other. And when they're not able to do that, that's where the changes in thinking, memory, judgment, behavior, and feelings can be affected. And there are certain parts of the brain, distinct regions of the brain that are responsible for different functions for us. And when cells in a particular region of the brain is damaged, then that area cannot function as normally. And we'll be looking at the specific types of dementia with these different regions. we're just going to list quickly here different types of dementia: Alzheimer's disease, vascular dementia, dementia with Lewy body, frontotemporal dementia, Creutzfeldt-Jakob disease, Huntington's disease, Wernicke-Korsakoff syndrome, and then other miscellaneous. There are other smaller known dementias. The first two, Alzheimer's disease and vascular dementia, are the ones that perhaps have the larger category for people, Alzheimer's being the primary one. So we're going to talk about 10 kind of warning signs, indicators that could be Alzheimer's. We're going to go through those. What happens with Alzheimer's is a memory is impaired, and that disrupts the daily life. Forgetting recently learned information, important dates or events, relying on memory aids to keep track, such as notes to a great degree. Not that notes aren't good or an indicator of dementia, but it could be something that a person is relying on more and more. Another warning sign is having challenges in planning and solving problems, such as following a recipe, keeping track of monthly bills, taking longer to do things that they used to do in a shorter time. Difficulty completing familiar tasks, and that could be cooking, fixing something, a hobby that they used to enjoy, driving, that to a familiar location becomes more of a problem, or remembering the rules of a game that they played for a long time. Another warning sign is confusion to time or place, what the season might be, what time of day it could be, forgetting where they are. And this, even looking at a clock and recognizing time, starts to lose the ability to do that earlier than sometimes you might think. Another warning sign is trouble understanding visual images and spatial relationships. We talked about walking over different floor patterns. That was 5. Here comes number 6. Another warning sign is new problems with words in speaking or writing. Misplacing things and losing the ability to retrace steps. We talked about that. And sometimes if things are missing or found in a strange place, a person with dementia might accuse someone else of taking them. Decreased or poor judgment, such as giving away money to telemarketers or responding to mail in a different way than they used to with money. Withdrawing from work or social activities or hobbies that they've enjoyed, or a sports team that used to be important to them. And number 10 is changes in mood and personality with increased confusion, some suspiciousness or anxiety, or becoming more upset when out of their comfort zone than they used to be. Well, we're going to take a pause here, and Tabitha is going to check and see if there might be any questions thus far for those who are able to.
Hey, Sandy, this is Tabitha. I don't
Hi.
see any questions in there.
Okay,
So if people decide they want to enter them in between now and the end, they're welcome to do that. I can read the questions at the end for you. But people can hold their questions too, because we'll be opening it up at the end and they can just speak them if they're more comfortable with that. But if they want
okay.
to type it in so that they don't have to speak it at the end, they're welcome to do that too at any point in time. So I don't see any in there right now, so we could move on from that.
All right, that sounds good. Thanks, Tabitha. And so everyone, I want to give you a chance to ask a question or comment if you wish. So we will take time to do that. And like I said, you could just write them down too, if that works better for you. These next slides, we're going to go over a little more quickly. There's a lot of information, but some of it it's in regards to information that might be familiar with you. And I think we'll just kind of go through it and mention it as we go along. Oh, I did need to go back to one thing about Alzheimer's disease, though. The brain changes. Talked about that, different regions of the brain. That you might have heard about plaques and tangles with Alzheimer's. Protein fragment beta amyloid is the name of the plaques, and twisted strands of the protein tau are found in the brain of those after they have been deceased. And they can occur up to 20 years before the person exhibits any symptoms of the disease. And again, this is a slowly progressive brain disease. I've heard mentioned 7 to 10 years. And of course, that can be different on either end. And the end course of Alzheimer's disease, this severe disease, tends to go more quickly near the end. And Alzheimer's is the most common type of dementia and accounts for 60 to 80% of all dementia cases. Okay, vascular dementia, that was one of the ones mentioned at the start. The symptoms occur as a result of blood vessel damage from blockage, which can lead to strokes or bleeding in the brain. The location of the brain damage is determined by how their cognitive and physical functioning are affected. So that can vary, of course, for different regions of the brain. Symptoms include impaired judgment or ability to make decisions, inability to plan or organize, which is similar to Alzheimer's, memory loss, again, similar to Alzheimer's, disorientation. What I understand about vascular dementia's course of progression is that instead of a slow downward track and then quicker towards the end, in the severe stage, vascular is like a plateau that goes out for a while, then it might drop down, go out for a while, drop down, more of a step pattern. But again, dementia can be a mixture of vascular and Alzheimer's. Also for vascular dementia, the damage can be seen at times by MRI or a CT scan. Vascular dementia can also occur with Alzheimer's or other types of dementia. Dementia with Lewy Body is another specific disease. It includes some of the similar ones we've talked about: memory loss, thinking problems, sleep disturbance, which although that can also be other dementias, but this might be more of a regular occurrence for dementia with Lewy Body. Visual hallucinations also is something unique, although I believe at times it can occur with other dementias. Also, the gait imbalance or other Parkinson-like movement features occur with dementia with Lewy bodies. And continue. What's happening with the brain is there's a protein called alpha-synuclein, which are what the Lewy bodies are. And if these develop in the cortex part of the brain, dementia can result. These protein alpha-synuclein can also clump in the brain of people with Parkinson's disease, but in a different pattern than with Lewy body dementia. Lewy body can also occur with Alzheimer's or vascular dementia. Frontotemporal dementia. Symptoms include something a little different, focus on a change in personality. Could have behavior issues such as increased anger, socially inappropriate actions, difficulty with language, could be more so than the other dementias. Apathy or lack of initiative, which is characteristic of frontotemporal lobe. And to know that it generally develops at a younger age, about age 60. More on temporal lobe, what's happening in the brain is nerve cells in the front and side regions of the brain are especially affected. So this is different. We're not hearing about protein clumps. We're hearing about the nerve cells being affected. The frontal portion of the brain controls mood, behavior, especially spontaneity, initiation, judgment, and impulse control. Sometimes it's been said the person has lost their filter to what they're going to say, and that can be an indicator of frontotemporal lobe. It controls the temporal lobe, part of the brain, controls auditory and visual perception, organization, language comprehension, personality, and sexual behavior. Okay, here we're going. So those are the specific various dementias, diseases of the brain. We didn't mention a few of the other ones on the list, but we could talk about those near the end too. They're not as seen as often. So probably a number of you are already doing this, but it's always good to review what's good for the brain to keep us healthy and as best we can. So we know about the heart healthy diet, sometimes called the Mediterranean diet. Lean meats, lots of fruits and vegetables, lower in fats and salt. Also, exercise is important for brain health. Walking, stretching, moving, whatever you think you're able to do, and to check with your doctor. Now, there's brain exercises that can strengthen our brain function, and it's recommended to do real world activities. So what is real world activities? That would be learning a new language. It would be picking up a new musical instrument, studying a musical instrument, driving a different way than you usually go, just challenging your brain with new experiences. So that's something that could be kind of interesting to think about. I've even heard maybe brushing your teeth with your left hand instead of your right hand, if you're right-handed. And the more senses you involve, the better it is for your brain. we're going to talk about some more here. Things that you could do to exercise your brain. Make a shopping list and then memorize it. You have to, that's something you intentionally do. You work at it and then see how many items you can recall. Join a choir. Sorry, that passed on a little too quickly. Create word games. Draw a map from memory. When you think of going to the store or someone's house. Challenge your taste bud. Try new foods and try to identify what spice could be in the dish you're eating. Refine your eye-hand abilities. This is probably with the toothbrush idea too. Take up knitting, drawing, puzzles. Learn a new sport that uses both your mind and your body, like yoga, golf, tennis, maybe Tai Chi, something that challenges your senses. We've said exercise, but hey, I think it's good to hear it again. Break a sweat, which is maybe more cardio exercise, walking faster than you usually do. Just do it for a while. Doing exercise by video, or if you go to the Y. Hit the books, read, stop smoking, reduce risk factors for heart disease and stroke, which was the diet and the exercise, and protect your head. If you're a biker, wear a helmet, reduce the chance of brain injury. So these again, it's worth saying again, to eat a healthy and balanced diet, get enough sleep. They're finding sleep is very, very important for the brain. And I understand naps are good, can be a very good thing for your brain. Take care of your mental health and decrease stress as you are able to. Stay socially engaged, which is a challenge, has been a challenge with the pandemic. Hopefully now that's improving and you can start to plan to get together with friends or family in a safe way. Challenge your mind with new activities, a new game. Now, near the end here, what I want to talk about is for someone who has dementia that you know or a new person you meet, some ideas to help with communicating so that the person feels comfortable and understood and you feel you're able to engage with a person with memory challenges. To have a positive tone of voice and friendly facial expression in the perception of that is very calming and could be helpful for a person with dementia. To be said to be patient and supportive if they're taking time to answer, to give them time to complete their thought or sentence. Offer comfort and reassurance. If you see a person with dementia struggling, say, oh, it's okay. Reassure. Perhaps if it's a safe thing for COVID, you could put your hand on a person's shoulder. Offer a guess if the person uses a wrong word or has trouble with finding the right word. And it's very important never to criticize or argue or try to reason, because the person will become more stressed and anxious and be difficult to continue to engage with them. Some more thoughts come from the front rather than from like around the side. If they hear you're talking behind them, that's confusing. They're hard to read that. Say your name. Get eye contact. If they are sitting, you can sit down to engage the best you can. Call their preferred name to get attention. Use short, simple phrases and repeat if needed. One question at a time with time to respond. Speak slowly and clearly in a gentle, relaxed tone, and then patiently wait for a response. Got some more tips here. There's lots of good communication tips that are very helpful. They maybe seem simple, but they really need to be intentional at times to help the person. Instead of saying, here it is, use the item by saying, here's your hat. Or over there to the bathroom, you say the bathroom is here. And use positives. Let's go here rather than don't go there. Again, that's tone of voice, which will be read by the person with dementia. The emotions remain strong, even when some of the memory or words are difficult. The emotions of response are very strong, just as for anyone. Give you visual cues if it helps to point. If they're eating and they're not sure what to do next, you could point or hand them the fork or toothbrush to kind of prime the pump to get things going. And avoid asking the question, do you remember? Because they're having trouble remembering. That would not be a helpful thing to ask. Try using a written note or a picture, if that might be helpful, if you're not sure. They need to use the toilet, they want a glass of water. Another idea to help with communication. Also know that if you talk slowly and move slowly, it's more comfortable for someone with dementia than talking quickly or moving quickly. They'll have more trouble following you and connecting. And if you ask a question, it may take up to 20 seconds to take in what you said and then for a response. If we think about how conversation goes, it's a lot of back and forth pretty quickly. That flow would be best to be very much slowed down for the person with dementia and time given to understand and to respond. There's some key messages that we're going to finish with here from our slides that are kind of a summary. I think they're very good. They come from a program called Dementia Friends. And just want to mention these. I've got some comments on each of these. Dementia is not a normal part of aging. It's more common among people over 65, but not everyone develops dementia. Some of us may become more forgetful as we get older or during times of stress or illness, but dementia is a different type of forgetfulness. Dementia is caused by diseases of the brain, as we discussed. And the symptoms of dementia from the disease are memory loss, mood changes, problems with communication, and reasoning because of these changes in the brain. Thirdly, dementia is not just about having memory problems. Dementia can affect the way a person thinks, speaks, and does things. It's harder to plan and learn new activities for a person with dementia. Each year, there's much research being done to find out more what's happening and what treatments can occur. Recently, a new experimental drug called donanemab, I'm going to spell it DONANEMAB, Donanemab is showing promise just of 2 weeks ago to slow cognitive decline. Donanemab is an antibody that targets and removes plaques from the brain. We talked about the amyloid beta protein that's found in Alzheimer's patients. So this is still experimental. They're still doing research, but this is a bright little piece of hope for Alzheimer's, as there really hasn't been significant medications that have been found to, certainly not to stop, and somewhat slow, but not to a huge degree so far. So it's a promise that the research is being done, the trials being done, things will develop and more treatments will happen, be available. Fourthly, it's possible to have a good quality of life with dementia. When we think about the word dementia, oftentimes a response that you might have, that a lot of us have, is like, oh, very negative. It is a hard disease, but it's possible to have a good quality of life. It can be surprising to learn that many people with dementia continue to be able to drive, socialize, and even as it progresses, people can lead active lives, have healthy life, continue their hobbies, and enjoy some friendships and relationships. Of course, dementia can make it harder to do things, but with the right support and know-how, it's possible for someone with dementia to have a good quality of life. Lastly, there's more to the person than the dementia. And that is so true. Just like any disease, cancer, diabetes, there's more to the person than the disease. That we need to see them as a person first. People living with dementia need to be seen as a person, and then the disease second. So that is something that we don't always think about, but it's very important to take that into consideration and to keep it going forward for people we meet with dementia, friends, family, or if anyone is experiencing some changes in their cognition.